If you or someone you know has dealt with years of shoulder pain due to a sports injury, you're going to want to listen up. According to the Hospital for Special Surgery, rotator cuff conditions are very common, affecting 2 to 4 million people in the U.S. every year. Dr. Jeffrey Liu is a board-certified orthopedic surgeon at Legacy's Orthopedic and Sports Medicine in Collin County, and he joins me to go over the latest advancements being used for shoulder surgery. Good morning. It's so nice to see you.
Good morning, Jane. Thank you for having me.
Good to have you here. Okay, you have here what is looking like a little water balloon, and I think we're going to get a shot of that. There it is. What is it?
So, Jane, this is it's called the in-space balloon. So it's actually from Stryker, and it was recently cleared by FDA for approval and use last year. So it's used for treatment of patients with massive rotator cuff tendon tears that can't be repaired. However, they have no arthritis. So recently it came out, and it's been amazing. In Europe, it's been in use for over 10 years in 30,000 patients. So I'm very excited to bring this new technology to North Texas.
Cool. Okay. So we have something we're going to watch on the screen, and you're going to walk me through it, right?
Yes,
show me what are we looking at here?
So here's the shoulder, and you see the head is actually hitting underneath the clavicle and acromion. So the procedure is actually done arthroscopically. You see we clean everything out, and we actually prepare the space for the in-space balloon. We measure the device, as you see there, and then we actually insert it through a 1/2 centimeter incision, very small, and the balloon goes there and it's inflated with saline. So the saline stays in there, keeps the balloon floated, and prevents the ball from hitting underneath the clavicle. It's amazing technology, and it's been amazing to see the results.
I am continually amazed at what medical technology can do. So people who are watching who may have had this pain for a long time should reach out to you at this point, right?
Absolutely, yes.
Okay. So you do shoulder replacements. How do you determine when that procedure is needed, and what does your practice do differently than most when it comes to that kind of thing? I know that's a lot.
Yes, very good. So for patients with severe arthritis in the shoulder, that have had long-term treatment conservatively, the shoulder replacement is still the best option for long-term pain relief and function. So in my practice recently, I've incorporated this amazing new technology from Stryker. It's called mixed reality. It's a headset I put on to help during surgery as well as pre-planning for surgery.
So what does the headset do?
So the headset you see here, I don't know if you can see the video.
Yeah.
It's put on my head, and I can see the patient's anatomy in a hologram.
Gosh.
So it's actually a CT scan that we use before surgery to prepare and plan for the patient's procedure. You see that hologram right there where I can move it around and move it toward the shoulder.
All right, that's almost too much for me, but I know it's a fabulous tool. So, and you're the only surgeon in Collin County trained to use this new technology. Is that correct?
That's correct, Jane. So this new technology is the forefront in terms of orthopedic surgery for the shoulder. So as I stated before, we use a CAT scan. I see a hologram during surgery, and I can better plan and be more precise during surgery with the cuts, how the implant fits. So every patient is specific in terms of how the shoulder replacement comes at the end.
So if there's someone watching right now who has dealt with shoulder pain for a long time, what would you say to them about what to do?
So the shoulder is one of my favorite joints to treat. It is the most complex joint in the body. There's 17 muscles and tendons that actually move the shoulder around. So with any type of shoulder issue, the most important thing is to get a specific diagnosis before we plan the treatment. So a lot of my patients actually in my office are treated without surgery. So where I am in terms of treatment, there's a lot of options that we have in tools.
That's amazing. Thank you so much for bringing all this to our viewers this morning. It's absolutely fascinating. Appreciate your time.
Thank you so much.
Okay, if you're ready to get moving, you can request an appointment with Legacy Orthopedics and Sports Medicine. Here's the number to call, 469-322-1400, or visit legacyorthopedics.com.